Hi, Dr. Hoehn.
Hello. Thank you so much for having me on your show today. I'm really excited to share with you guys.
I really am too. This is one of my favorite topics, and I have tons of questions for you. You are an acupuncturist, a doctor of acupuncture. Let's start with, did you always want to do that? Did you start elsewhere? How did you end up here?
Yeah, I'll try to give you the bird's eye, the drone view of this. So basically, I was in the film business. I was an underwater photographer, and then I was also an AC camera assistant for a long, long time, for like 25 years. And I got injured at work and I fell out of a crane. I got injured. And the thing that
Oh,
got me back on my feet was acupuncture, right? So at that moment, it was like my acupuncturist became my mentor in a way. And every time I would get injured at work, it was like I would go in on Sunday and my periods would be instantly better and I would not be broken anymore, right? So it's just like in that time of my life, all I wanted to do was just get back to work as soon as possible.
hmm.
And I was like, wow, there's really something to this whole medicine, right? And I felt so passionate about it. And then I was also really concerned about being older and what the film business was doing to my body. So I went back to school and I became a general acupuncturist. And then I realized that I needed to support my camera sisters a little bit more. And because they were going to work with the same pains, aches and pains, right? Like painful periods, cramping, a lot of that stuff. And you just go to work as an AC, right? Like it doesn't really, you don't have a sick day.
Hmm.
And so then what I did was take a deeper dive into reproductive health and fertility and later on in fertility research. So that's what I got my doctorate in. Um, but it all came because I really wanted to have my population enjoy accessibility, education, empowerment to a medicine that is so that they knew about their choice, right? So, like, they knew about their choices in healthcare. And that's pretty much how I ended up here.
So, what was your program like to become a general acupuncturist? I mean, that's a huge 180, right?
Yeah.
We don't have to go off on this tangent, but people probably don't know, and I don't know too deeply, but I do know drug use in that film of business is extremely high because people like pain med use is like
Oh,
overused, I feel
yeah.
like. And generally I believe it's like not so much women, but definitely more men. And we don't talk about that side of that business at all because there's so much physical work that you have to do. Like that, of course you wanted to come up with something else, but I've never met someone that did that much of a 180. I love it.
Yeah, I mean, they say like your mess becomes your magic, right? So it's like that was a really interesting, like, I got into healthcare to help more people just like me, right?
Yeah.
So that was my biggest turnaround. In answer to your question, to just be a general acupuncturist, it's a master's program. For me, I was working full time in the film business while I was getting my master's, so it took me a little longer. It took me about 4 years to complete mine. And then there's a pretty rigorous clinical training, like in terms of the residency aspect. And then there's a board certification, like a state board certification in California. Um, and then the doctorate took me, and my reproductive health certification took me like 3 years each, pretty much with the exams. So it was a lot. It's a lot of school,
It's a
to
lot of
say the
school.
least. It's a lot of school.
And why did you want to get the additional certification in reproductive health?
Um, well, at that time, I just felt like there was just a really huge gap in women's health and also choice, right? So I noticed that we were just kind of approaching interventions in women's health with either the pill or HRT, like depending on where you are in the spectrum, right? And there wasn't any middle ground to stop and figure out and diagnose and think about other ways of treating besides these two options. And so then I found the herbal part of the medicine, which is very, very powerful. It's really the left hand of the medicine. And I noticed that there was so much more opportunity to treat people at a fraction of the cost and without all of the pharmaceuticals. So that's why I got interested in it.
And what makes, I know that this is, you can't go into this whole answer, but what makes reproductive acupuncture or fertility acupuncture different? Is it just have to do with the pain points, the meridians? Like, what are the actual makeup of reproductive acupuncture?
Yeah. So in terms of acupuncture versus like general acupuncturist versus a specialty, it's again another couple of years of certification. We are part of an organization called ABORM. Um, and the point selection and the knowledge base is different, I would say. And then also you have an affinity towards different types of herbal medicine. And so when you specialize, what happens is you start having the experience of seeing the same clinical pattern, right? So you see the same kind of conditions, and then you can master those, right? Instead of being a general acupuncturist it's just confusing for me because um a general acupuncturist will see a shoulder pain patient, then a back pain patient, um then dizziness, then right, then reproductive health. So it's like you're getting thrown like just all of these conditions at once, and it's just not helpful for the medicine, right? So even in a Western framework, like a podiatrist is not going to check your ovaries, right? So we're having that really nice time in our lives as acupuncturists where we do have specialists, right? So, for example, like if I see a skin issue or something that looks like psoriasis or something, I'm going to refer to Dr. Black, right? I'm not gonna pretend that I know what I'm doing. Like Dr. Black has a master's degree in dermatology from like one of the most prolific dermatologist acupuncturists in the world. So like I'm not going to know what to do with skin, right?
Hmm. Right.
So
Um, and did you, okay, so then how after school, so how long have you been practicing now?
yeah, 12 years.
Oh my gosh, I feel like
12.
you must have started work when you were 12. You're so young.
Oh, that's so sweet. No,
Yeah.
I'm in my mid 50s.
Oh my
So,
gosh, you look
yeah,
amazing.
so I
Do
started
you needle your face yourself
I
to look?
do. I
Yes.
do. I needle my face. How did you know about needling your face?
Oh, just from my own very long fertility road and the various acupuncturists that I met along the way as
Oh,
well.
it's that's very smart. Yeah, okay. So you know about fertility acupuncture, right?
Oh
And
yeah.
so you can always ask the fertility acupuncturist to needle your face. Shameless
Yes.
plug here. Yeah.
Totally. While you're in there, why not?
While
You
you're in
know?
there. Yeah, I don't know why
Totally.
nobody asks me to do that.
I think, like you said, I don't think people really know,
Yeah.
you
True
know?
story.
Yeah. And I mean, and I've done, I actually, there's another acupuncturist I've worked with who needed some fertility coaching. So we traded. I coached her. She did needles in my face. And it was the best trade ever for both of us. But
Best trade.
there's a lot of needles that go in your face when you're doing,
Yes.
it was a lot.
Yes, it depends what style you do, right? So it's like the Meizen style is like that's a lot of needles and they're very tiny,
Yeah.
right?
That's what it was. It was crazy.
Yeah, good
Like,
times.
whereas, fertility, which I've done a million times, it's just vary a couple points, depending on what your needs are, which brings me to for my fertility community, I think there's often like a fear that we didn't start acupuncture early
Oh,
enough in our
mm.
journey, or a fear that just doing it, sometimes people are like, I didn't start and now my transfer's next week. Is it worth doing it? And I always say, yeah, it's worth doing around transfer. That's when the most evidence has been shown because it's been studied. What is your version of the ideal fertility timeline of acupuncture?
Oh man, this is such a good one. I like think about this all the time. Yeah, so we I think every fertility acupuncturist is going to meet the person where they're at, right? So it's going to have, to your point, like it's going to have a profound effect on the body and what that outcome looks like, regardless of whether or not it's like, oh my God, I saw you in the hallway and now I want transfer acupuncture. That's happened to me several times, right? Um, and also, like, I think that framework is usually to be conservative, like 6 months is a really epic time frame, right? In the States, we see somebody like once a week for about 6 months. That's a really great thing because, the engagement starts to get a little stale after like month 3. And so just continuing that engagement and staying with it when you're really busy and you're like other things get in the way and health starts to take a back seat, is really important. So it's really good to have a coach with you, right? So at that time.
Yeah. And if somebody can only do it around transfer, do you think it's worthwhile?
Oh, 100%. I mean, you know this, right? Already with your experience that, um, fertility acupuncture is really having a heyday now. So, and that is because of specifically a breakout study that is very old now. It's like 2 decades old. It's called the Paulus Protocol. And it was the first time where we got a really great sample size in a study. And it shows that doing a specific protocol 30 minutes before the transfer and 30 minutes after, we can get we can improve the outcome by about 35%.
And
So
oh, sorry, go ahead.
that's huge,
Yeah.
right?
Yeah. Huge.
Huge.
So, can you tell us what is happening within that 30 minutes before and after that gives it such a ramp up of
Yeah.
percentage?
So the point selection is all about, and so when I say point selection for your listeners, what I mean is like it's almost like it's like a recipe, right? So that recipe of points along different meridian systems comes together and comprises that treatment. Like with the Paulus protocol, there are set points, right? So there is customization opportunity, but like in general, what we're trying to do is relax, regulate the cortisol, relax that uterus, create better uterine receptivity, and get better blood flow to the uterine lining, right? So that that embryo and that uterine lining can really have a very deep conversation and successfully work together, right? And then afterwards, what we're doing again is bringing that energy towards the uterus. And so that we can really work on better blood flow to the uterus.
Do you think people should have fertility acupuncture or acupuncture in their 2 week wait?
I do feel like that. Yes. There is still a little bit of a window there for uterine receptivity. We're still working on that hatching process. So yes, for sure, I do. I recommend at least twice a week after in that wait week as well.
And do you, when you feel your patient's pulse in in those weeks, do you
Yeah.
have a sense of whether the transfer has worked or not? Is that a myth or is that true?
Um, I think it's a little too early to tell. Like, I
Okay.
don't know, what was your experience? Did you feel it right
Oh,
away?
girl, I did so many transfers. It's like one time she
Oh,
thought it worked, it didn't. One time it didn't, it did. Then I lost. I mean, it was like a whole
oh,
rigmarole of things.
oh my gosh.
But people will say things, or acupuncturists will say something like your pulse is slippery. Like,
Yes.
what does that mean?
Yeah. Yeah. I love talking about this. So yeah, so remember that like in TCM, traditional Chinese medicine frameworks, we really have to create a diagnostic pattern, right? So we create that pattern assessment through a really comprehensive intake. We use the tongue, right? So the quality of the coat of the tongue, the shape of the tongue, and the coloring of the tongue will tell us. It'll lead our pattern differentiation a little bit. And then to complement that, we have the pulses at 3 levels, the upper, the middle, and the lower pulse. And so what we're doing is we're training our fingers to really learn what the quality of the pulse, the blood feels like as it moves through the vessels at these different levels, right? And then from there, what we try to do is create what's called a pulse image. So we're actually pulling that narrative out of the pulse so that we can customize the care. So there are standard pulse images that we're trained to learn. Slippery is shows us that there's phlegm, right? So the embryo is considered phlegm, right? So slippery feels like pearls rolling in a dish. Like if you were to take a dish and you were to roll it around on the table, that would be slippery, right? And
And you
then
can
we,
feel that in the pulse when you're feeling.
yeah.
Wow.
And certain things are like a heat or a big flooding pulse. Like I have a visceral sensation when I feel that, right? It's like a we call it like a I call it like a baihutang, like a big pulse. So like I feel it in the base of my skull, like all the way up to the top of my head. And then there's like choppy, which just feels like a credit card scraping along bamboo.
Mm.
And then we have wiry, which we feel all the time, right? That's that tight guitar string kind of quality.
Amazing. So you treat accordingly. And that's how, do you use
Yeah.
that to pick your points?
Exactly. Yeah. So
Okay.
we take the tongue, the pulse, and like what we call the asking song, which is our kind of comprehensive intake. So it's like the whole thing is a mnemonic device so that we know like what functional diagnostic pattern we're trying to pull out.
Mm. And when you're treating using acupuncture during like a stimulation cycle, or even if people haven't gotten to IVF yet and you're just treating for general fertility before maybe they move to treatment, what are the benefits? Because I think what I've heard is it's so nourishing to your ovaries. What are you nourishing? How does that help? And how long do you need to be doing it for it to work?
Yeah. So I would say, it takes 180 days to recruit a follicle, right? So ideally that would be like the best container for results, but we can see improvement in like 3 or 4 weeks as well. Um, and so what we're doing like with the herb, so it's really important to go to a board certified acupuncturist and herbalist, right? So I will make that distinction. It's really important. You can do that in California. Other places, not so much. So you have to really make sure that they have that certification. And the herbs really complement the point selection during that time when you're not in treatment, right? So what we're doing is trying to work on that follicular environment so that we're supporting a really healthy recruitment of that follicle or oocyte. And on the male factor side, what we're trying to do is work on test sperm production, right? Making sure that we're relaxing, regulating that person's cortisol response, making sure that we're getting really good blood flow to the testes. Um, and then on the female fertility side, what we're trying to do is reduce that inflammatory response around the oocyte in that follicular sac, right? So we can get better blood flow, better exchange of nutrients into that sac so that we're supporting that oocyte to the best of our ability.
And can we talk about supplements? How do you feel like
Yeah.
supplements help? And the herbs, on my journey, I only had a small period of time where I did the herbs because I had to switch from my person to very, very traditional Chinese medicine person for a couple weeks. And I could barely drink them. They
Oh,
were
did
like,
you have like a raw formula or was it a tincture or?
it wasn't a tincture. I guess it was a raw formula. It was a powder that I would mix with hot
Oh, the
water.
powders. Yeah, the powders are
And
gross.
it
Yeah.
was probably the worst thing I've ever tasted. I used to take a lozenge with it so that I could like taste the lozenge, but it was so nasty. But
Yeah.
you're like, I'll do whatever it takes. And if this is what it takes, I'll do it, you know?
Yeah, I mean the herbs, the granules, I've just like loved the granules when I was at first out of school. And now I'm just like, you know what? I want compliancy. And so the way to do that is through a tincture, right?
Mm.
So it's like really I use kind of more of a compost style formula building where it's almost it's very modular. So I'll take a base formula and really figure out like what that general diagnostic pattern is and then supplement with modifications at a certain percentage based on some other symptoms that I see, right? And so you always just kind of want to, with the herbs, you really want to follow the phases of the cycle so that you're getting the best therapeutic effect.
And do you feel like how long do the effects of acupuncture last? Because sometimes I think for me personally, I'd go in my session, I'd feel really relaxed, and an hour later I'd be a mess again or just like really stressed.
Oh,
I would
oh,
feel like the cortisol can only stay low for a certain amount of time. Is the goal to keep it steady for a while?
yeah, yeah. So I think it's more esoteric, but when you think about coaching somebody and supporting them through fertility, I always think about it as like managing resiliency, right? So it's like managing resiliency in the body physically, and then also how that person, I do deep dives with my people. I spend a lot of time with them, right?
Mhm.
So it's like it's really a partnership. and trying to give them the right tools so that they're managing that stress and that cortisol when they're not in the room with me, right?
Yeah.
And I think that in answer to your question, like how long does it last? Like it's a compounding effect, right? So it's like the more you go, the better off you are going to be and be able to self-regulate.
Mm. If somebody, well, you said you mentioned before you also work with people on maybe like with HRT as an, is it as opposed to HRT in conjunction with HRT? And who are the people that, is this like perimenopausal people,
Yeah.
menopausal people? What demographic is that?
Yeah, so in perimenopause, actually it's funny, I'm like starting to shift my paradigm and my studies into perimenopause because of my patient base, right?
Yeah.
Like I've been in practice for so long and I never thought this was going to happen, but like people are done with baby number twos at my office, which is like what a relationship to have with
Yeah.
somebody, right? What an opportunity to like really provide clinical support. It's been really awesome. And now these women are like coming to me like, "Oh, Dr. Hoehn, you've got to figure out perimenopause because like we don't know what to do, right?" So, there's not a lot of research on perimenopause at all. But we do know that there is a lot of research on vagal tone. Things like vagal tone can be really powerful as an adjunct therapy and support to HRT.
What is vagal tone?
Vagal tone is stimulating and strengthening the vagus nerve, which
Okay.
travels all throughout our body and can create that sense of rest and digest, right? So, simple things and coaching people on vagal tone can be really helpful with those vasomotor issues that you have in perimenopause as the estrogen starts to decline. We also know that acupuncture and herbs can really help the sleep wake cycle and solidify that sleep wake cycle because sleep becomes a really, really huge issue as estrogen starts to fluctuate, right? So learning how to provide that support and that nutritional support and that comprehensive support is really at the key crux of women's health while you continue to study it, right?
Are you anti-HRT?
No.
Okay. I'm
Would
just
I be? What?
curious. No, no, you didn't answer that you weren't. I'm just
Oh,
curious, like what I
yeah.
see a lot in the marketplace, not necessarily from you, is like avoid HRT and do this instead.
Oh,
So I'm just curious how you work with it, or if you
yeah.
try to get people in a different state of being before so that they don't have to go on HRT, or if you're all for it. Like, how do you feel
Yeah.
about
I
it?
think that you really need a collaborative, comprehensive silo for yourself around or support around HRT. You know, there's a limited therapeutic window for HRT, right?
Hmm.
So that needs to be considered. There's a ton of baseline testing that you should consider getting before you get on HRT. And then my argument about our HRT right now is that I love it. I think it's a great support system, but like, how are we monitoring these patients, right? So it's like we're creating these one size fits all HRTs where we're stimming the crap out of the estrogen part, but we're not counterbalancing it with progesterone. So it's really an art to balance and monitor a patient. And just like when somebody comes in and says, "Holy crap, I am so bloated and like my pants don't fit anymore," like, or they're having other estrogen dominant signs, right? Like, freaking listen and stop, like, lay off or like supplement progesterone, like, right? So there's a whole bunch of ways to intervene there, but like making sure that we're not just prescribing HRT and that we're really monitoring responsibly is really important.
I love that. If somebody came to you and they were like, I want to be an acupuncturist, what should I do?
I would say run, marry rich.
Marry rich, baby. That's the answer to very many things.
Yeah, I actually teach in the doctoral program, and then I also have some interns that I mentor. Yeah, I mean, it's really hard to do it aggressively, right? It's like a lot of work. I don't know what I would say about it. It's really like a dedication, right? Like to your life. I don't like full disclosure, I don't do a lot of other things. Like people are like, what are you doing for fun and balance? Like it's like I'm
Acupuncture.
some
Yeah. Yeah.
practice because just to stay current on any research or understanding or learnings is like that's a whole other tool, right? And then there's the, as you know, the small business side of everything and staying relevant and connecting with your peers and, you know, keeping all the balls in the air is really hard.
I'm gonna do, if you're willing, I've been doing like a little rapid fire questions with people to wrap things up.
Snickers. Just kidding.
Also the answer to everything. That's
Also,
what my husband would say the same thing.
yeah.
Okay, we'll start super easy. Hold on, where's my
Okay.
little list here? So that I don't mess my questions up. Stand by. Oh, here we go. Okay. Well, this one's easy. Coffee or tea or neither because
Coffee.
caffeine. Okay. And how do you feel as an acupuncturist about coffee?
Love it.
Great. Actually, let me ask this too, as long as we're on that. Are you anti-cold everything like during
Yeah.
IVF? Yes. Okay. That was something that was real hard for me because I did a lot of IVF in the summer and I was like, I cannot sleep without my air conditioning on. So then I'm like, do I go for the air conditioning to get sleep or do I forego
Oh
the
my God.
coldness for these are hard
These
decisions.
are hard decisions.
Yeah. Okay. Beach or mountain?
Both.
A wellness trend that you're actually obsessed with right now?
Seed cycling.
Okay. One thing you never thought you'd be doing, but now you love.
Um, yeah, I guess herbal medicine.
Okay. And finish the sentence. I feel most like myself when.
I'm running with my dog.
Oh, that was a good
Yeah.
one. Thank you so much for
Yeah.
being here. We're going to link out. Are you accepting new people if they need you?
Yeah. We're hiring a couple new doctors. We're over in Toluca Lake, so come by, check us out, and you can always book a 15-minute consult with me. And then I'd love to get your info. Like we should totally
Yes.
refer patients to each
We
other. That
a
would be
thousand
amazing.
percent yes. We'll do
Yes,
all
I
of
love
that.
that.
Thank you so much for being here.
Thank you for like letting me contribute to your community. I really appreciate it.
Oh, we appreciate it.